Good morning, Claire.
Morning, Anne.
Good morning, everyone. It's very nice to have you this morning for our final webinar as part of the Health Literacy UK series. So we'll give it a few minutes for a few more people to join and then we'll get started. So very nice to see you, Claire. Thanks for presenting this morning. We're really looking forward to hearing about your work.
Thanks.
I can see from your
I
back.
heard about it all before anyway, Anne.
Oh, no, it's all very interesting. Yeah, it's always good to hear. You must be back in work, are you? Are you in the office?
I am, yeah. I tend to come in to do presentations and things, although we had a bit of a nightmare yesterday with doing a presentation. You kind of feel you've got some assurance with coming into work that technology will be on your side, but yesterday gave us the flip version of that.
Yeah, you never know. Yeah, well, fingers crossed for this one this morning now. Just turn my emails. And in terms of work, were you doing stuff on health literacy yesterday or just general other parts of your work?
Yeah, well, both, but the presentation we were doing was on health literacy yesterday morning to some community groups.
Very good. Yeah, really important topic. I think over this past year particularly, we have seen how important health literacy is when you're trying to make decisions around you know, the information and the guidance and trying to understand the messages that have been coming out. It hasn't always been easy. So I think now more than ever, we see how relevant and how important it is. So
and even just keeping up with the information that's coming out as well has been a hard enough job for us, even as practicing professionals. So
so really important. Really looking forward to hearing. I have seen your slides. They're very good. They're lovely. So I'm really informative. So I think everybody will enjoy them.
Good.
Yeah, see. It's just turned 12, so we can give it a few minutes to see if any others are joining, and the recording will be available and they'll be made available on the Health Literacy UK website. The three across the month were presented. So I think the theme of this year's webinars, we're really looking at community empowerment and how important health literacy is across all levels, but particularly looking at how we can ensure that health messages are getting communicated across community groups to individuals, and looking at how people receiving messages can be empowered to use them or to feedback or to make the health system easier for everyone to integrate with through their responses and the information they provide. So this fits very well with that theme. Absolutely a movement that was led by people and their needs. So I think it's great to have a champion within the Health and Social Care Trust leading that and being able to take on board the needs and the views of people to inform how the health services delivered and developed and designed. So I think we're at a very crucial point at the minute where the health service is being reviewed. So within that, then hopefully there'll be a greater focus on certainly health literacy or clear communication across all services. Okay, so we'll maybe get started. I'll just give you a wee welcome and background. So Claire, you're very welcome today. Looking forward to hearing more about the work that you have been doing across the Northern Health and Social Care Trust, and delighted that you can be with us during the final webinar of the series. So for yourself, we have a background. Claire, you are the Health and Wellbeing Manager with the Northern Health and Social Care Trust, and you qualified as a dietitian in 2003, and you took up post in North Yorkshire and worked across acute, community and health promotion services with adults, children and families. During this time, Claire developed an enduring interest in multidisciplinary working, person-centred and personalised care planning. Since returning to Northern Ireland in 2014, her career evolved from clinical dietetics to community health and wellbeing services. In this capacity in 2019, tasked to develop health literacy, she engaged members of the local community to co-produce and develop a health literacy initiatives and promote good practice both for those who use services and those who provide them. Currently, she is working to develop an integrated social prescribing service founded on good health literacy practices, incorporating the principles of co-production throughout design of services. For this session, Claire is going to share the Northern Health and Social Care Trust health literacy developments, initiatives and resources to support good practice. Fantastic. So we look forward to hearing from you. Claire, if you are able to share your screen. That's great.
Okay, Anne?
That's you now, yeah.
Perfect. I'm just going to pretend nobody else is here. It's just you and me, Anne.
Yeah. So if anyone has any questions as we're going along, you can put them in the Q&A box, and we'll ask them at the end. There'll be the opportunity at the end to ask questions, or we can invite you just to speak to Claire directly and ask your questions. So thank you, Claire.
Thanks, Anne, and thanks very much for the group for inviting me along today to this session. Well, as Anne said, my name is Claire Ramsay. I work as a Health and Wellbeing Manager in the Northern Trust in Northern Ireland. In 2019, as part of my part-time role, I was tasked to develop health literacy for our team and for our trust. In this presentation, I'm going to share with you some of our action points in demonstrating how we applied health literacy in action. But first of all, we needed a good place to start, and where better than the actual title itself of health literacy. We wanted to make better sense of that term for people to better understand, and who better to ask than a group of our service users. We sent out a call to help to some community group leaders, asking for their help in recruiting willing volunteers to take part over a series of 2 workshops. We didn't provide very much context to that, knowing that the term health literacy would probably have put them off. So we had a group of people together, and obviously we needed to ask them what is health literacy. We couldn't just do that as coldly as that first sounds. We would have scared everybody out the room. We got to know each other over a cup of tea and sort of in the signing in process. got to know each other's stories and a bit better understanding of each other, but we still did have to ask the question, what is health literacy? The nicest way we could think of doing that was to actually provide them with a short list of some of the commonly cited definitions. We asked them for their critique or their feedback on what they understood by those definitions, and they told us that they were all too wordy and too academic to be within their reach or relatability. They couldn't see that they were relevant for them or important for them to take cognizance of. We discussed their preferred definition, which was actually from Health Education England, and that definition reads that health literacy is about people having the knowledge, skills, understanding and confidence they need to be able to use health and care information and services. Now, our service users still felt that by this definition, the topic was still only relevant really for professional people. It didn't portray any relevance or understanding or importance to them. So they made some minor modifications to this in order to create that relevance and relatability. Health literacy now is about our knowledge, our skills, our understanding and confidence to be able to use health and care information and services to make good health decisions. So once they had this clear understanding of the definition and terminology around health literacy, they could also understand the sense of its importance and the direct impact it would have on them. We asked them what advice they would offer to people who provide health and care information and services, and what information or advice they would offer to people who actually rely on those services. Their advice for providers was very unanimous, and it was take time to ask. Ask us what's important to us and what we want to get out of that consultation or that appointment or that piece of information. For people like themselves and their peers, it was to make time to listen to the advice that they were given, but also then not to feel embarrassed or ashamed to actually ask questions if there's something they don't understand. As much as you can see that this is divided into advice for providers and for peers, both those pieces of advice are actually interchangeable between the two. During these workshops, we also asked them to work with a graphic designer to come up with some sort of visual aids that would help with the clarity of the term health literacy. This is one of the versions that they came up with. Next thing was we sent this definition along with the other short list that we'd already provided them with, some of the graphics they had designed and some of the catchphrases and slogans that they had come up with during our sessions, and put that out for a public vote across our area in the Northern Trust and our neighbours in the Western Trust. We received 229 votes from the general public, with a unanimous preference then for our service user-led definition and the graphic that you can see on the screen here. That graphic you can see includes their advice for providers and service users to take time to ask and make time to listen. This goes to show that a small group of service users can represent the wider views of the general public if we actually ask them the right questions and get the right representative group in the first place. Now, that was what we had planned to actually get out of those two workshops, but actually as an unplanned aside from that, during those workshops, service users openly shared their stories and their experiences of their health and care encounters. Not all of those were positive, and of those that were less positive, many of the themes were recurrent within the group, and people related very easily to those stories. And for me as a practicing healthcare professional, I found that a lot of those scenarios were entirely preventable. So as part of their advice given to peers, remember that take time to ask, make time to listen, we thought there was some work that could be done around making and taking notes in preparation for and during discussions in relation to people's health and care. We wanted to offer some practical support, and earlier this year we worked with a different group of service users to produce this resource, and I'm going to give you a bit more detail about that shortly. And having now heard their shared experiences and the commonality of those lived experiences that were ultimately causing a poor overall service user experience, we've produced some videos playing out some of those experiences while highlighting good health literacy principles in practice. We've also now developed a toolkit of handy and practical tips and supports to embed good health literacy into our culture and practice when we give or receive health care information. The ultimate goal here was to improve the user experience from each of these tools. Now, we learned early on that service users like a starting point. So they provide a general idea. We produce something that we think fits the bill. We hand it back to them and ask them to critique it. We encourage them to be very open and honest with their feedback, and reassure them that we have very broad shoulders to take that feedback. So this was their first idea that was formulated during those initial two service user workshops. We produced the document you can see on the right-hand side here, which is Take Time to Ask and promotes health literacy. We called together then 3 focus groups and had a total of 18 participants. The usual story, mostly women, but we got them together and asked them whether or not they felt this was a good or a bad idea, whether it was clear, whether they would use it, and to ask for their general comments about the content and layout. On the left-hand side here, you can see the more positive comments in the blue speech bubbles. Service users told us that it was clear, they definitely use it. They thought it would help them to think more and focus more during appointments and in preparation for appointments. They thought it would give them more input during their consultations and would be a useful resource to have. Someone even said they felt it would put them more in control during those consultations, but overall they felt it was a good idea. On the right-hand side, then you can see maybe the less favourable comments, maybe not entirely surprising. This group of service users, like the first one, don't like the term health literacy. They wanted us to simplify the introduction. They wanted it as an A5 sheet of some description and in the largest font possible. They wanted us to provide them with more space for them to write their answers to the questions that they proposed during the consultations and to put a box at the bottom for a bit more information. So we took on board their feedback and actually reworked it to produce this document that you can see on the right-hand side. We now have that as an A5 tear-off pad. You can see that we've removed the title health literacy from the logo or the graphic at the top of the 2 speech bubbles. We've left more space for notes and further answers to their questions. We've included a section at the bottom for them to include more important information. And the one thing that they always liked from the first document was this section at the bottom, which was who do I call if I have questions after my appointment. So we need to kind of promote the fact that people need a little more time to process and actually reflect on the information that they're given. They then need somebody quite promptly or available within the next few days or a week in order to be able to address those queries or concerns so they can clarify their knowledge before they can apply it in practice. Otherwise, what happens is they wait until their next review appointment in 3 or 6 months' time, and they still haven't acted upon any of the advice they were given previously. So that bit's really important for us to keep included in our resource development. This resource is now being piloted with our community pharmacies. Our council, mega change officers and home accident prevention staff are also going to utilise this resource, as well as hopefully our community navigators. Service users did tell us that there was more opportunities here that we could potentially explore. While a lot of them felt it was useful to have their own supply, being that they maybe have regular health or care appointments, for those that maybe don't have so many regular appointments, sending something like that with an appointment letter could actually be a useful prompt to people to prepare and plan for their consultation. They also felt it could be something that would be readily available in waiting areas, so that while people are waiting for their appointments, they can focus their mind on why they're there. And that was the first resource that came out of that service user engagement. And it was some weeks after those initial 2 workshops that I was still continuing to think about their lived experiences that they had shared and how preventable many of those less positive aspects of their encounters had been. I felt it was important to act on what I had heard. We had to capitalise on some sort of learning here. And while I appreciate that it was uncomfortable maybe for a lot of people, or lots of people would have met their scenarios with disbelief, it was too commonplace for us to be able to ignore it or sweep it under the carpet and pretend we never heard it in the first place. And this is where the idea of video media came in. Now, that wasn't actually planned to be a straightforward process, as it turned out. So after capturing their lived experiences, we started to develop scenarios fusing their stories together. We wanted to maintain the relevance and relatability of those scenarios, but without it having a negative slant. So the context offers tips and techniques to enhance the user experience. We recruited service users to role play their part. We employed a creative agency to be able to develop the videos and film those. We had to work with information governance to produce data protection impact assessments and privacy notices, as well as detailed consent forms. We were proposing to do 5 complete videos, and we had 2 of those filmed just on the mouth of COVID. So once COVID hit, as a service, we were redeployed to a shielding service. And when our service was able to reset, we had to reimagine this work. And it was from here that we got the idea of developing these stories into animation format. Now, this involved layering the scripts by writing in non-verbal cues and body language. We had to build the characters and the backdrops, and then we had to develop the animation. We were very keen to sense check what we had created here. So we held a virtual focus group with another new group of service users in order to get their feedback. And again, true to form, I didn't provide very much context in the sense of health literacy, but trusted that people would come along to actually share their honest feedback. We showed them the animation and asked them to tell us back what they felt. The messages had been what they had learned from viewing that animation and whether it was something that they could relate to and it was relevant to them. They told us that the purpose seemed very clear for them. It was very relevant for them. They actually enjoyed watching it. And they actually said that they would feel more confident in actually taking part in their health and care consultations, even if that was just something as simple as asking a question if there was something that they didn't understand. I'm going to just play you one of these animations now. Now, it was embedded in this PowerPoint, but I have had technical issues, so I've taken it out. So we'll come back to this. This is the first animation in the series.
This is David. You wouldn't know it, but David struggles with reading and writing. Imagine David gets a letter to attend an important health appointment. If the letter contains lots of information, this will be confusing. David may not understand it. In good practice, the letter will clearly state the date, time, location, and reason for appointment. David arrives on time for his appointment because the information provided was easy for him to understand. Everyone finds it easier when the signs to follow match the information they have been given, and especially when the words are easy to read and understand. David knows exactly where to go. Like most people, David will be a bit worried and anxious about his appointment. He won't be familiar with the setting, who he will see, or the process of what will happen. These factors can be very unsettling and can mean we are less able to take in any information we are given. Giving David lots of information very quickly and in words he can't understand is unhelpful. However, if David is given clear information in words and language that are familiar to him, and if he is encouraged to ask questions, he can understand his health better. The next time you are in a situation where you are giving or receiving information, try to be clear about the following 3 questions. 1. What is the main issue? 2. What do I need to do? 3. Why is it important I do this?
Hopefully that worked for everybody there. That was the first video in our series. We actually created then a further 4 scenarios with 4 different characters. We've got Bill, Anka, AJ and Katie. Bill's story is a gentleman of older age who is having a home safety check with a council worker. Anka's story explains the difficulties people have with providing information on a form or providing any form of written information. And AJ has been advised to make some lifestyle changes, but he's overwhelmed by all the public health information and who to trust and where to go to for the right help and support. And Katie's story follows the journey of how you can choose well when accessing health and care information and promoting the role of community pharmacies in supporting health and care interventions. Each of our 5 scenarios and 5 characters actually have 4 different versions. So we have a version of the plain text with the plain audio, which you've just observed there. We have a version with subtitles, one with British Sign Language and one with Irish Sign Language. We haven't yet translated these into other language, but that would be fairly easy to do if that becomes necessary. My video and animation media was new to us, with the latter even being novel for the creative agency that we had contracted with to develop this work. So aware that COVID had hit and video media would probably become more to the fore, we decided to produce some information to share our learning, not just of the outcomes of the animations, but also the process to get there. That's what this talk sheet actually here is for. So it was just 1 slide to actually share with other people about what we had learned through the process of developing these videos. And that really includes information about understanding that an external creative agency won't be familiar with our policies and practices in our trust. They won't know about our corporate branding or our policies or procedures, or even the generic public health messages that we're so familiar with, using them every day in our practice. That obviously does cast limitations on the use of creative license. There is still some employed there, but we were getting to the point of really having to be very niggly about that all. Also, the concept of health literacy, working with an external partner, that needed constant reiteration throughout the whole process in order to share and realise our vision and our service user visions. We really needed that agency to be able to engage with service users more actively than what they have done. So after we had sort of shared that learning and other people were using that to develop their own video or media information, we then shared our learning through the actual process, through the end point here, which was developing these animations. And that provided a challenge all of its own. Our trust IT and security system, probably like many other people, restricts file size and access to software such as Dropbox, which would have made it much easier for us to share these files and receive these videos in the first place. We were able to use egress for a while to share files, but that quickly became very cumbersome and restrictive, especially when it came to internal sharing of files, and that was due to license permissions within our trust. And that's when we discovered Page Tiger and a chance encounter with another group of staff. So you can imagine we have 5 separate scenarios. We have 4 versions of each of those videos, and we had our Deputy Chief Medical Officer kindly did an introduction and sound bites so that we were able to knit all those 5 scenarios together to one complete feature-length video, which we can use for training and teaching purposes. Now that's 6 separate videos, each with 4 scenarios. We've got a total of 24 videos, and we didn't want people coming back to us each time to request a specific version of a specific video. So they're all in one document now, very easy to navigate, health literacy animation Page Tiger. So that link is a live link that can be sent out to anybody who wants it, and then anybody can access the version that they require from that. That brings us to the launch of those animations. Now, we just launched them actually this month. They did take a long time to get to this point, but I suppose as part of Health Literacy Awareness Month, it makes sense that they must have been delayed on purpose. So they have been launched, and we're more than happy to share those with anybody who's interested in receiving those to use in teaching or training, or to put out on their social media. So that was our second resource that came out of our service user engagement from that very first contact. The third one I'm going to tell you about today, which I'm sure you're not sorry about, this service user inspired resource is actually a health literacy toolkit. This toolkit offers practical tips and techniques and tools to support anybody who provides health and care information or services. The toolkit sets the scene for health literacy. It includes some details of the facts, the effect of health literacy on service users and on providers. And the content reflects service users' issues, such as difficulties that they often encounter with finding their way to the right location for their appointments or venue for their care. It also goes through how we can help them to better understand spoken advice and information that they're given, as well as engaging better with written material that we provide. It offers clear guidance and solutions, focusing on preventing many of the root cause barriers which impact uptake and application of good health decisions. It offers top tips, posters and cue cards to support the application of good practice. Again, this is done as a Page Tiger, and I can't take any credit for that, but on the Page Tiger it's very interactive, so you can see that there's additional sections that you can click on to take you to further information. So you can download a top tips poster, and you can download top tips cue cards. The cue cards themselves, then, they can actually be a standalone resource, but we have got them incorporated within the toolkit. Those cue cards are actually derived from the 8 top tips within the toolkit, and each of these cue cards offers more detail regarding the importance and impact on the service user or the service provider actually applying those techniques in their practice. So while we had produced that, we did want to get some validation for what we had achieved here. It came out of the ideas of service users, but it wasn't right to ask service users to pull that together for us. So we pulled together a first draft as a hard copy. We then asked a group of our trust team leaders. Now they were a group of staff who had already done a piece of work on to develop a health literacy project in their own area of work. We asked them to kindly review the toolkit, and hoping that they knew me well enough to know that I could take the feedback to actually give me honest appraisal of how they felt about it. The first thing we asked them was whether or not they felt their knowledge and understanding of health literacy improved as a result of reading the toolkit. They all said yes, it did. They found that initially the first cover was off-putting because we had used our traditional corporate branding on the front cover, but quickly whenever they got into the body of the document, they realised that it wasn't cumbersome at all. They had used quite a lot of colourful pictures and diagrams. And the layout they felt was very nice and well planned. They felt the information offered was handy, applicable, and in bite-sized amounts that they could easily apply in practice. They liked actually the use of graphics, and that was something that I was a bit nervous about because using clip art can sometimes feel a bit of a childish thing to put into documents, and my background's actually paediatric dietetics, so I was very conscious that maybe that was swaying my view of how this should look. But actually professional people really liked the graphics. They found the information was well condensed and that the key takeaway messages were very clear and easy to pick out. But we also wanted some sort of assurance from our service users that if the information within that toolkit was actually used and applied in practice, would it make a difference to them during any of their health and care encounters? So we set up another group of service users and pulled them together, and they all said that yes, it absolutely would. Mainly because they said they would feel listened to. It would be more engaging for them to be part of that process of their care, and it'd be a much more positive experience for them. Then we asked service users and staff whether or not they would recommend the toolkit. Thankfully, they all said yes. And they said that it would be something that they would recommend to all staff. And this went beyond health and social care trust staff. It included those in the community and voluntary sector who work with the general public, as well as charities. And the reason was simple, because it was going to benefit service users at the end of the day. Will anybody be better off as a result of these 3 tools that we have developed? I'd really hope my time was well invested here. I do think there could be benefits for service users and for service providers. By us being open to launching and sharing these widely with other people, we can hopefully go on to develop people's knowledge, skills, understanding and confidence. That will encourage more effective and efficient use of health and care information and resources, which should ultimately lead better health decision making and improve the overall experience. And I don't mean that just on the part of the service user. I actually feel as a service provider, their experience would be enhanced as well by having much more meaningful engagements with the people who they interface with. For service users, we have the tear off notepad and we have the animations. They all offer consistent messages. Any of the tips and techniques are easy for them to implement in practice. And by us starting to create more accessible information and services and encouraging them to get involved with some of the work that we're developing, we hope that they can feel more empowered to speak their mind, speak up if they're not clear about something, and actually get more involved in their health and care encounters. For service providers, again, through the animations and the toolkit, we're offering very consistent messages. Again, the tools and techniques that we're advertising or promoting here are easy to implement in practice. And the use of the feature-length animation, which our Deputy Chief Medical Officer has introduced, can be used as a 10 or 12-minute video, and that can be used in the training and development of staff and teams. And ultimately, we're trying to achieve embedding good health literacy principles in our culture and practice within our team and within our organisation and with others who we engage with. Really, I find it hard to think why anybody wouldn't be better off from engaging with these tools that we have developed. If we actually truly listen to our service users' initial advice, which was to take time to ask and make time to listen, then we have to be able to prove or acknowledge at the very least that we have heard what they have said and that we have acted upon it. Now, I'm sure you've all heard enough from me, so I just want to thank you all very much for your time, especially over lunchtime today, and thanks to Anne for inviting me today. I'm more than happy to take any questions or comments if anybody would like to either unmute or put them in the chat. Thank you.
Thank you, Claire. That was fantastic. There were definitely a few things hit home for me during your presentation. The use of the 3 questions. I mean, I think everything has changed during this past 18 months where we have even service delivery, how you're used to attend an appointment from my point of view. So I did use the 3 questions during a doctor's appointment over the phone because I was really nervous. I thought this is different, you know, speaking to them over the phone, very convenient, but it was completely different. And I'm very aware that even, you know, your cues around body language and what you would naturally pick up on in a room when you're face to face with someone weren't there. So I find it fantastic to be prepared, to have those questions. And at the end of it, I was like, that was really good. So putting them into practice, you know, they just change everything. But the fact then that, I mean, I suppose essentially health literacy is really the balance between people accessing services and how services are provided. And I just think that toolkit and the animations really bridge the gap, because it's speaking to both people that use services and making healthcare professionals aware of very simple things that can just make it an easier experience for everyone. So I am very enthused by your presentation, and I think others are too. So let me see the comments. Jackie Willis is saying fabulous, Claire. I'm sorry, I bit my tongue yesterday, so I'm just not speaking 100%. So Jackie is from Derbyshire Community and Voluntary Sector, and she wants to ask, am I able to share your toolkit with our Derbyshire STP? So I'm not sure what STP is, but it must be a healthcare provider.
Thanks very much, Jackie. We're actually at the process. We finalised the content of the toolkit, and we're going to pilot that now with 2 groups of staff to deliver some health literacy initiatives in their area of work. Once we've done those pilots, we will more than happily share those with anybody that's interested. We're not precious in the Northern Trust and in our team. We want our resources to go to anybody that can actually benefit from them. So yes, I can keep your details and get back to you with that whenever that pilot's complete.
Great, thank you, Jackie. I think it's the ICS, it must be Integrated Care System. A comment from Bernadette Cullen, who is chair of our health literacy working group with Belfast Healthy Cities. Bernadette says, a great presentation. Congratulations on getting this work completed despite COVID challenges. Absolutely, I completely agree. Mike has his hand raised, so I'll unmute you, Mike. There's just one question in the chat before I allow you to speak. So I'll just put it to you, Claire. It's from Jean Hawley, and this is very interesting to hear about the whole process you've been through and fantastic resources that I'd like to use in more detail to see how we can use in Derbyshire. So you're happy with sharing, Claire, as you said?
Definitely, and if anybody wants to contact me even after this for more detail about any of them, I can also share them in draft form. I have no issues with that.
Yeah, so the recording will be made available after the series, so they'll go on in the next week on the Health Literacy UK website, and we'll add your contact details, or you can share them in the chat and people can contact you directly. Thank you for that. Mike, if you have a question, you're more than welcome to ask it. So Mike Oliver presented at the last session last Tuesday, and really interesting work with the health champions in Stoke-on-Trent, and Mike is a member of the Health Literacy UK group. If you are,
yeah, can you hear me? Can you hear me okay?
Yes, thank you. Go ahead.
But thanks very much. Thank you, Claire. That was wonderful and inspirational. Just really like the form that you have encouraged people to fill in before they went to a healthcare visit. Did you do any work to prepare the healthcare professionals so that when somebody turned up with a form and they were well prepared, they knew what to do and they weren't sort of taken aback? So like the other side of the coin.
Yeah, no, very interesting point actually, and we haven't, but it's nearly been intentional. I presented this work at the Integrated Care Partnerships here in the Northern Trust area. A lot of the GPs were very interested in it. I don't know if that's just the GPs that are involved with the Integrated Care Partnerships or if that's all GPs. So that's definitely something I need to explore further and to see how it does get received, and that might actually come out of the pilot that we're going to do with those resources in one of our council areas, to see what kind of reception they're met with.
Thank you. Yeah.
Thank you, Mike. And I think they're really transferable, you know, whether it's primary care, secondary care, or generally council wider services as well. You know, what are the main issues, what's important, what I need to do. So I think, you know, it's a really valuable resource to have, to be able to share right across community planning partners.
Anne, can I just, can you still hear me? Can I just follow up on that? No, it's just, we did something similar in Stoke-on-Trent called It's Okay to Ask. And some of it went very well, some of it was mixed. It was quite interesting. So some of the healthcare professionals, and I use the word some very advisedly, were utterly delighted and could see the point of it, and others were a little bit more, who are you to tell me how to do my job? I know how to get this information across, and by the way, I haven't got time to be doing all this. So we had the full range of responses, from the inspirationally wonderful and receptive to the get out of my professional space. So it was just an interesting experience, some good, some bad.
I'm probably kind of anticipating the same thing here as well, Mike, knowing some of the personalities probably that would be in each of those camps. I don't actually know how we get around that, or if that's something I should maybe link in with you about to see what the best way of doing that is. Because I don't really need any training, but I do feel the need acknowledgement that we want service users to feel more empowered during consultations, and this is a practical way of doing that.
Yeah.
And even, you know, if there's evidence to suggest that this is a time-saving tool, you know, because time is precious for everyone, so to make the most of that conversation or that time. And I think it is planting the seeds as well through the animations around what else needs to be looked at in terms of simple things for the system. The appointment letters you highlighted, the signage in hospitals. So, I mean, it's definitely a great way of highlighting, you know, things that could make easier for people to be involved. So great. Yeah, well done. So what's next, Claire?
I'd like to say a foreign holiday, but I don't think that's going to happen anytime soon. No, I think we're at the stage now of piloting some of these resources, and then as we're setting up our integrated social prescribing service, it's really going to have health literacy embedded at its very core. Yeah. So we're doing lots of engagements with service users and other groups of staff around that, and these tools and things that we've developed will hopefully then go some way to training those staff and actually getting them better understanding of how that actually applies in practice. It's very low in the theory, but actually doing the do is a bit different.
Yeah, definitely, in all settings. Very good. It'll be, you know, to some, you know, they'll be very aware of it already. I think particularly in social work and in pharmacy, it seems to be just part and parcel of what they do. And they're across all disciplines. I mean, there'll be, I suppose, a real appetite or maybe already an awareness for this. So Karen Casson, also a member of our health literacy working group, Claire has commented, wonderful resources, Claire, and really brilliant to see the level of engagement with service users and service providers in the production of these through co-production. So absolutely. And I think that's something that is highlighted in the review of the health service here, really emphasis on co-production. So hopefully it'll be certainly a highlight or a place for it within that. Very good. So you've shared your contact details, or if anyone wants to contact Claire, it's claire.ramsay@northerntrust.hscni.net. Great. Okay, well, I don't think we've any more. If we've any final questions, you can get them in the chat box or raise your hand to speak directly. Otherwise, it's just for me to say thank you so much, Claire. Really inspiring to hear what you have developed and what is to come. And I think even for a resource right across Northern Ireland or right across the UK and Ireland to be able to be shared, it's fantastic. And good luck with the next steps and what will be happening next. The recording of this webinar will be available on the website, and you can contact Claire directly if you would like to speak to her further about her work. So thank you, Claire.
No problem. Thanks a million, Anne. Bye-bye.
Yes, thank you. Bye-bye.